Johns next for 2.5 minutes, please.
So we've lost over 42,000 Canadians due to unregulated toxic drugs. In the United States, it's been hundreds of thousands of Americans. We don't need more evidence that toxic street drugs produced by organized crime and profited by organized crime is what's killing people. 30 states in the U.S. doubled in overdoses in 2 years. None of them had safer supply. So that's the evidence that harm reduction actually works, because we know that in BC, deaths have gone up 5%, and Ontario at 6.8%. That's not good enough. We need to ramp up safer supply. In Alberta, where they scaled down harm reduction, no safer supply, no decrim, focus on recovery, absence and criminalization, they're skyrocketing death rate at 18%. In Saskatchewan, similar to Alberta, 32%. In San Fran, they closed their safe consumption site in 2022 for 11 months. 11 months later, their death rate went up 25%. So Alberta has made safe supply prescribing illegal. They will fine doctors who provide life-saving care $10,000 a day for every patient who these doctors provide safe supply to. Alberta is reducing support for and closing safe consumption sites against all scientific evidence. And since Alberta made these ideological decisions, overdose deaths, like I said, have surged 18%. What will this government do to limit the harms of Alberta's ideology-driven policies? And what will this government do to support the people of higher risk of death due to Alberta's policies?
So thank you for the question, very important question. I'll do my best to answer it. It kind of in some ways goes back to the minister's sort of fundamental position around what the federal strategy is and the work that we're doing with all provinces and territories. And our support and our understanding of the impact of harm reduction services is unequivocal.
We need both.
And
we need both. Harm reduction and treatment and recovery, prevention, education, and decriminalization. All supported by the police of Canadian Association of Police Chiefs.
And from where we sit, that is the government's strategy. A full continuum services from prevention and harm reduction and treatment and recovery, aftercare supports, the whole continuum. And we do a lot of work directly, as the minister said, in supporting community, as you know, supporting community-level interventions where there aren't otherwise supports, particularly in the harm reduction space. We have supported, and I think the ones that I have in front of me right here are the 39 supervised consumption sites that have seen 4.5 million visits since they were first established 6 or 7 years ago, 52,000 overdoses and no deaths. So we understand fully the impact and the importance of harm reduction in dealing with the very acute end of harms.
Very harm selling hoodies to keep their doors open.
Yeah, I know.
Thank you both.